This is Day in the Life, part of a series of videos showcasing the amazing diversity of health-related jobs. In these interviews, we'll hear a little bit about what a day in the life of a health professional may look like. We will explore what it means to be in a health-related field that impacts policy. Thank you so much for being here with us, Margie.
It's my pleasure.
Now, can you tell us on a daily basis, what are some of the most important things you do as the Executive Director of Health and Medicine?
Sure. So one of the most important things I do is mentor young people. So I have a staff of about 14 people, many of whom are early career public health people, and we always have interns who are medical students, public health students, social work, law students, and I mentor them in lots of different areas, but particularly health equity and how public health can have an influence on really changing our communities and creating equity in all of our communities in Illinois. So that's one critical thing I think I do. Another is interfacing with public officials at the city, at the county, and at the state level to help them think through how to reform health systems that exist to make them serve the populations they're trying to reach.
What are some of the most important things that you did on a day-to-day basis as the Commissioner of Health for Chicago?
You know, when you're a physician and you're seeing patients in your clinical practice, you can have a huge impact on the lives of the people you're working with and you're interacting with and you're learning from. At the health department in Chicago, the focus was really on policy systems and environmental changes so we can create better environments for Chicagoans to live in, and that's a great way to improve population health. So we focused on things like policies around tobacco. How do we make sure that we have the right policies in place so kids don't pick up this deadly habit? How do we make sure that the price of the cigarettes in Chicago is not too cheap so kids can afford it? How do we make sure that flavored tobacco are not available around kids? How do we make sure that we're regulating e-cigarettes? We've also focused on the built environment. How do we make sure that there are bike lanes in our city? There are spaces for kids to be physically active, to be safe, being physically active in the communities. How do we make sure that our school days are long enough to ensure that every kid has recess and PE classes? Those are the types of things that we focused on during my tenure at the health department in Chicago. The other area that I think is also as equally as important is the interface between public health and the healthcare system. There are a lot of opportunities here to get these two systems better aligned, to work together, to talk together, to improve population health.
Can you tell me a little bit more about how you impact health from the policy standpoint?
Okay, yes. So a lot of the work that we do is funded by foundations. About 90% of the work is at the request of foundations to help them understand how to leverage their investment so that they can do their work in a way that's really going to make a major difference in people's lives. I mean, I'm really impressed with the level of commitment by philanthropy to really begin to address a problem that in the past was viewed to be under the public sector. And so they're filling a gap now that didn't exist before. And so we may be asked to help them figure out how to train their staff in understanding what needs to change in their environments in order to have healthier communities. And so we might go in and do trainings with their staff, do capacity building. We might bring people together. We might bring unlikely partners to talk about what needs to be done differently in communities. How do they engage the local policymakers? How to work with the school in order to improve conditions in schools. So it's all about how to help people on the ground have the tools and resources that they need to make the changes that's going to promote an equitable society. It's less about us doing the work and us helping people to know how to do the work for themselves and linking groups with each other.